The health risks associated with radiofrequency radiation, or RFR, are rapidly becoming a chronic disease crisis in America. Under Democratic leadership, particularly during the Obama-Biden and Biden-Harris administrations, regulatory actions or inactions have contributed to this escalating issue. From appointing key industry figures to regulatory positions to halting critical cancer research, the story is one of neglect, suppression, and misclassification of public health risks. The Obama-Biden legacy, Tom Wheeler's appointment, and the beginning of the RFR crisis. In 2013, President Obama appointed Tom Wheeler, a former lobbyist and president of the Cellular Telecommunications Industry Association, or CTIA, to head the Federal Communications Commission, the FCC. Wheeler's appointment raised immediate red flags due to his deep ties to the wireless industry. Placing someone with such clear conflicts of interest in charge of regulating that very industry was a pivotal moment that set the stage for today's RFR health crisis. Under Wheeler's leadership, the FCC doubled down on outdated safety guidelines, focusing exclusively on the thermal effects of radiation. This approach completely ignored the non-thermal effects of RFR, such as DNA damage, oxidative stress, and increased cancer risk, effects that have been well documented in numerous scientific studies. Wheeler's tenure at the FCC reinforced the industry-friendly misclassification of RFR health risks, perpetuating the myth that RFR only becomes dangerous when it heats tissue. The Biden-Harris administration halting critical cancer research. When Joe Biden took office in 2021, many hoped for a shift in regulatory focus toward protecting public health, particularly given the growing body of research linking RFR exposure to cancer. However, rather than prioritizing the latest science, the Biden-Harris administration chose to halt the funding of the National Toxicology Program, the NTP, the most significant research study on non-thermal effects of RFR. The NTP study, which spanned decades and cost $30 million, found clear evidence that RFR exposure could lead to cancer, specifically malignant heart and brain tumors in animals. This groundbreaking research should have spurred immediate action from federal regulators. However, rather than embracing the findings and updating safety guidelines, the Biden administration stopped funding the NTP. This move not only jeopardizes future cancer research, but also signals the administration's continued alignment with industry-friendly policies that prioritize corporate interests over public health. Kamala Harris, a continuation of Biden's policies? Kamala Harris, who has already stated she sees no reason to change Biden's policies if she is elected president, would likely continue the same approach to RFR regulation. This means the misclassification of RFR health risks as thermal only would persist, ignoring overwhelming evidence of non-thermal biological effects. It also means continued defiance of the court order demanding the FCC update its safety guidelines. In 2021, the U.S. Court of Appeals for the District of Columbia ruled that the FCC's refusal to update its RFR safety guidelines, established in 1996, was arbitrary and capricious. The court emphasized the FCC's failure to address non-thermal health risks, such as non-cancer effects, and ordered the agency to reassess its safety standards. Despite this ruling, the FCC, under Biden-Harris, has refused to take meaningful action, leaving millions exposed to potentially harmful levels of RFR. The chronic disease crisis. As the Democrats in power continue to neglect the health risks of RFR, the public faces a growing chronic disease crisis. Studies have linked prolonged exposure to RFR not only to cancer, but also to neurological disorders, reproductive issues, and cognitive impairments. These are not isolated incidents, but part of a larger public health emergency, fueled by outdated regulations and political inaction. Ignoring non-thermal effects is no longer tenable in a world where wireless devices permeate every aspect of life. We are exposed to RFR 24/7 through smartphones, tablets, laptops, Wi-Fi routers, and cell towers. The refusal to update safety guidelines based on the latest research puts millions of people at risk of long-term, cumulative exposure to radiation that goes far beyond just heating the body. What's at stake? If Harris becomes president and continues Biden's policies, the public will likely face another 4 years of regulatory inertia. The FCC and FDA will continue to operate under outdated guidelines, ignoring the court order to address non-thermal effects. This means the real dangers of RFR, cancer, neurological disorders, reproductive issues, will be dismissed, leaving the American people vulnerable to the health impacts of wireless radiation. A call for change. It is imperative that the FCC and FDA stop ignoring the overwhelming scientific evidence linking RFR exposure to serious health risks. The courts have already recognized the urgency of updating safety standards, and yet, under Biden-Harris, progress has stalled. We need a leadership that prioritizes public health over corporate profits, one that will take meaningful action to protect us from the growing RFR health crisis. Conclusion. The Democrats, from Obama-Biden to Biden-Harris, have played a significant role in perpetuating the RFR health crisis. Tom Wheeler's appointment to the FCC marked the beginning of a dangerous era of regulatory capture, and the Biden administration's decision to halt critical cancer research has only compounded the issue. If Kamala Harris is elected president and continues this path, the FCC's outdated, industry-friendly guidelines will remain in place, endangering millions of Americans. The time to act is now. We need updated safety standards, based on the latest science, to protect public health and prevent a chronic disease crisis driven by RFR exposure. Visit RF Safe to learn more.